or I'd like to introduce Navjot Sandhu. Apologize if I didn't pronounce that correctly, please correct me. And she's coming from Stanford University, and she will be discussing her abstract, Radiation Oncology, Virtual Elective Rotation for Medical Students and Residents, Implementation of a Natural Virtual Education Resource. So I'll turn it over.
Great, thank you, Dr. Jean. So my name is Navjot Sandhu, and I am a clinical research coordinator at Stanford and also the program coordinator for the Radiation Oncology Virtual Elective Rotation, or Rover. And today I'm just going to be presenting some of our initiatives and the data we've collected so far. So Rover was really developed during the COVID-19 pandemic when in-person clinical rotations were suspended. And since the rotations are one of the few avenues for students to learn about the field of radiation oncology, we thought the suspension was really significant, and especially since a large percentage of medical schools do not require oncology-focused clerkship. So to address this need, we developed this virtual education program for all medical students and residents to improve interest and knowledge in the field. For the format of the initiative, we leverage virtual platforms to hold live educational panels and case-based discussions across the various disease sites. We hosted the sessions over Zoom and utilized interactive poll questions and Q&A to engage the audience and to promote discussion amongst the panelists. For advertisements, we use social media, primarily Twitter, along with several mailing lists, which included Arrow, Acro, and AirPack. And we also had sign-up flyers that we shared with individual programs in medical schools. And when we initially started the program, it was tailored for medical students only. But as we went along, we got a lot of residents attending these sessions, and they expressed interest in having a similar platform with more resident-focused education. And as a result of that, we developed our Rover 2.0 for residents. So these sessions were moderated by radiation oncology residents and faculty, and we included about 3 to 5 faculty panelists from academic radiation oncology programs across the states, and the cases included workup, imaging, and treatment patterns across different institutions. And we collected data for Rover by having the participants complete pre and post surveys, which were collected using REDCap. And we assessed the effectiveness of these sessions by looking at feedback after each of the sessions and kind of evolving these sessions as we went along. So altogether, Rover and Rover 2.0 included 42 panelists across 28 institutions, and about 1,300 students registered for these sessions, of which 676 unique attendees actively attended the live case discussions. And on the right, I just have a brief table looking at Rover versus Rover 2.0 to kind of show the differences in frequency of the two programs. So on the left, you can see the Rover sessions for medical students were a summer series with 6 sessions over 3 months, and they occurred bi-weekly for 1.5 hours. The first hour was reserved for panelists to do the presentation, and the latter was for discussion and questions. In contrast to that, Rover 2.0 sessions took place from October throughout the academic year until June, and took place on the first Friday of each month for about an hour. And then below that, we kind of have brief panelist demographics listed here. As you can see, we had nearly 41% of the panelists who were female, and 44% were assistant professors for the Rover, and similarly 44% for the Rover 2.0 sessions, and 31% who were assistant professors. And at the bottom, we just have the different session topics that were used for each of the respective programs. And here we have the demographics for the students and the residents who attended these sessions. And on the left, the Rover sessions had a pretty even split amongst gender between males and females. Nearly a quarter of the attendees were M4s, and the second highest percentage was PGY1s and PGY2s. And that's the reason we developed Rover 2.0 for residents. For the medical students, we also wanted to capture the reason for signing up for these sessions, and the top ranked choice was education, followed by networking and just helping with specialty selection. In contrast to that, for Rover 2.0 resident sessions, nearly 57% were male, and about 27% were PGY4s. And the top reasons for the residents for signing up for these panels included opportunity to hear from a diverse panel, followed by sufficient number of didactics, but kind of an interest in a new virtual learning platform. And we also wanted to specifically capture whether these virtual platforms were equal or superior to in-person teaching and learning. And about 63% of the residents agreed with that statement. So in summary, for analysis for the Rover medical student data, we saw that there was an interest in applying to radiation oncology. Didn't change significantly. There was only a 1% change, but we think that might be attributed to the fact that 73% of the medical students had some prior exposure to radiation oncology already before they attended these sessions. And interestingly, we also captured whether the respondents had improvement in perceived knowledge due to participation in these sessions, and that was significant. For the Rover 2.0 sessions thus far, we haven't looked at the complete data set because we have to look at the May post surveys, and we also have a session coming up. But from the data set we have so far, 98% of the attendees felt that the sessions were valuable or very valuable, and an overwhelmingly majority also would recommend these sessions to a fellow resident. So in conclusion, the Rover platform is a feasible virtual and open curriculum for medical students and radiation oncology residents, regardless of institution or country. And it provides a great platform for future trainees to hear from experts in the field across various institutions. And in addition to increasing access and knowledge through these virtual platforms for medical students, we see that a large number of radiation oncology residents consider online learning to be equal or superior to in-person learning. So that kind of speaks to the potential of potentially having supplemental virtual education platforms in the field going forward. So for future directions, we're going to continue to host our Rover summer series for medical students and the Rover 2.0 sessions for the residents throughout the academic year. And we have our last Rover 2.0 session coming up on June 4th of next month. And then we continue with our Rover summer series starting on June 25th. And then we have our website here, radoncvirtual.com, where we have the full schedule of previous Rover sessions and our future Rover sessions going forward. And I also have the flyer for our June sessions. We have a great list of panelists coming up who are going to discuss thoracic malignancies. So I have the QR code there and the link, or you can just go on to radoncvirtual.com to see what our sessions are about. And then I want to just give a big shout out to the Rover team, Dr. Paul Khan, Dr. Field, and Jimenez, our great residents, Dr. Dyke, Obeid, and Miller as well. And I will just conclude and see if anyone has any feedback, any questions that I can take back to the team on how we can continue to improve these Rover sessions. And also my email at the bottom, if any of the panelists want to contribute cases or want to become future Rover speakers, please just send me an email. Thank you for your attention.